Hi friends, welcome back to my channel Sharing Simple Knowledge. Today we are going to look a role play regarding mouth ulcer. So let's look how can we do this role play. So during your 3 minutes preparation time, please read the information carefully. So first of all, check the setting, what it is given. So in this role play card, it is given a community health clinic. Then next one is what is your profession? So here in this cue card it's given nurse. Then who is your patient? Here it is mentioned a 34-year-old person has come with mouth ulcers. So we don't know the patient name. During role play we can ask the name. Then the complaints. It is mouth ulcer. Then what other information is given in this card? It is written here, patient is feeling irritated and wants to get rid of it. So we can see patient is feeling irritated. So accordingly we can ask the patient the condition. Okay. So let's look the task. First, reassure the patient. As we know, if there is mouth ulcer, it can make eating, drinking and talking uncomfortable. So please try to reassure the patient. It is important to take history. What comes next is explain the causes and clear his doubts. And the last thing is here, give dietary pattern to be included and excluded. So like this role play cards, if the information is only a few, what we have to do? We have to make sure we are interacting with the patient. So we can ask some questions related to his life situations, taking history. So in that way we can extend and we can achieve the 5 minutes time. Otherwise there will not be any information. Here are only a few information given in this role play card. So always try to do like that. Let's look how we can do. So first we will introduce, this is a community health clinic. So we can start with according the time. If your exam is afternoon, you can wish the patient like good afternoon. Or if it is mentioned that we are going to serve a breakfast to your patient in the hospital ward, so you have to of course you have to wish good morning. Don't, even though the exam is doing afternoon, don't wish good afternoon. And or sometimes they are mentioning the time, it's midnight at 2 a.m. the patient was brought to the emergency department 2 a.m. like that. In that situation we have to wish according to the time. Okay, I think it's clear for you. So first we have to, mostly the exam is conducting afternoon, we can wish good afternoon. So the patient will reply. So we have to pause for some time. Then we can tell them, please be seated because it's a community health clinic. Next step, we have to introduce ourselves. So for example, just tell, I'm Miss Sarah, one of the registered nurses who is working in this community health clinic. Then tell them, I can see you look so worried. Could you please tell me what brings you here today? Then they will tell the problems like mouth ulcers I am experiencing for like that. So we can ask them, for my documentation purpose, could you please tell your name? Or we can ask them, how can I address you? So for example, imagine this patient's name is Miss Maria. So we can tell them, see Miss Maria, I can totally understand your situation you are going through. But nothing to be worried. You are here in the right place and we are here to support you. So it is a type of reassurance we are giving to make the patient more confident. Then next we have to take the history. See, in this role play card they are given only a few information. So we have to make the patient interact in this role play card in order to achieve the 5 minutes target. What we have to do, we have to ask them a lot of questions and get the information from them. So we can ask them, if you don't mind, can I ask some personal informations, or can I ask some questions related to your personal life or the routine life, like that we can ask them. Then they will, of course you can. So then we can ask them, how long have you been experiencing this situation or the problem? Don't ask them how long have you been suffering. It can be a judgmental, so just ask them how long have you been experiencing this problem. What else thing we can ask? So do you have any other medical conditions? Are you taking any medications? Then they may tell, I don't have any problem. I am not taking medications, like that. So we can, how long you are experiencing this? How frequently you are experiencing this condition? Or is it the first time you have had this problem? So they may tell, this is the first time I experienced, that's why I feel worried and it make me distressed. So I just want to get rid of it. That's why I'm here, like that they may tell. So we got all history related to that. Then explain the causes and clear his doubts. So we can ask them, do you have any idea regarding this mouth ulcer? And there are some causes for this one. Let me explain in detail. Is it okay with you? We have to ask in between to them, are you following me, or do you have any other questions that I need to clarify, like that we can ask them. So there will be interaction between the patient. So let's explain the causes for mouth ulcers. Just explain one by one. Tell them I will explain in one by one in detail. So they will agree for that. And after getting the history, we can tell one thing also. Thank you for sharing your information, so I get a clear picture about the situation. So I will explain the causes in detail. So the first one is accidentally biting the inside of your cheek. The next comes injury from a toothbrush or constant rubbing against dentures or braces. This is also a cause. That's why we can ask them, are you using any braces, like that? So they will tell, I'm not using. Or if they are using the braces, they will tell, I'm using braces. So it is one of the causes for a mouth ulcers. Then burns from eating hot food or viral infection such as cold sore. Then even reaction to some medication or vitamin deficiency. The last comes is there is a chance for mouth cancer, and even stress, it can cause mouth ulcers. So we gave all causes, but it will be fast and no need to, as we don't have much time, there is no need for detailed explanation. So they got some information regarding the causes, and if they have any clear, just ask them, do you have any questions? Then whenever we ask something, we have to introduce with their name. See, Miss Maria. All right, Miss Maria, do you have any concerns or any questions I need to address? Is it clear for you? Like that we can ask them. So we will get a feedback from them. If they ask some questions, we have to answer for that one also. We should be a good listener to them. Don't just focus on the role play card. Just listen to their answers and answer accordingly. Okay. Then next we can tell them, so but it is not a serious condition as you think. Don't think, judge like that it is a cancer. It is a common condition which is seen in many of the patients, and it can be managed with some medications and proper precautionary measures. So they will feel relaxed. Just tell them in between to reassure, don't be panic, just follow our advice, you can be recovered from this disease condition. Then next is the management. Please make sure to ask permission from them. Let me explain regarding the management. Is it okay with you? Like that. Don't uh, play like a monologue. It should be a dialogue, interaction between the patient and the nurse. Okay. So let's see what are the management we can do for this or oral ulcers. Just instruct them. It is important to avoid spice. One more thing I would like to say, during taking history, we can ask which is your food preference or what is your food preference. Are you vegetarian, non-vegetarian, or do you like spicy food, like that? So we will get information regarding his preference. Then one more thing we can ask, do you have any habits of chewing gum, or are you smoking, then drinking alcohol, like that? Also we can ask them. Then let's look at the management again. So avoid spicy or sour foods until the ulcers heal. Then drink plenty of fluids and keep mouth always clean. And regarding the brush, we can use the soft brush. Then again reassure them, if you follow this advice and take proper medications, you can recover from this disease condition and you will feel much better. So then we can tell them, thank you for, just ask them, do you have any other concerns? Then they will tell, I don't have any concerns and you cleared all my doubts, like that. Then they will thank you for sharing all information and thank you for visiting me. Take just care. Tell them, if you have any other concerns, you can approach me at any time. I think it's clear for all of you, and if you have any doubts, just comment below. Thank you. Bye.